everyone. It's my kitty. I decided to make a video just for people who are looking for the same kind of videos. I'm all over YouTube trying to find people who are going through what I'm going through, just to hear their experiences, to know what to expect. So I'm here to share my cancer journey with you. And everyone's cancer journey is different. So the things that I experience and the things that I go through may not be the things that you experience or that you go through. But I just wanted to share what I'm going through so that other people who are afraid or nervous or just want to know what's coming next can kind of hear my story, and maybe if there's something that you could get out of it, that's what I'm here for, just to share. That's something that I've been really interested in, finding some other YouTubers who are doing similar things, sharing their story. It's encouraging to see people who go through the journey and they're starting out, and then to see where they end up and to hear them say that they're cancer-free. And I can't wait to get to say that myself, but let's just go ahead and get started with my story. So I have stage 3 breast cancer. I'm 34 years old. I found a lump in my breast myself at home and went in to see my doctor, and she said, oh yeah, let's biopsy that, or not biopsy, but do a mammogram. And then the mammogram people were like, oh yeah, let's biopsy that. So they definitely saw some strange areas on the mammogram that they wanted to go ahead and collect biopsies of. So the mammogram was not bad at all. If you are a young woman hoping to get a mammogram or thinking of getting a mammogram, or you're afraid to get a mammogram, I urge you, go get one. They do not hurt as bad as I've heard people say. It was really just completely fine for me. As I was not more than a little bit uncomfortable. Definitely having like my blood drawn is comparable to how uncomfortable it was. It wasn't bad at all. It was no big deal. So then going in for the biopsy, if that's something that you're scared of, if you're scared of getting a mammogram because of a biopsy, then I understand that a little bit. The biopsy was not easy for me. I did have to have 2 different places biopsied. So they do numb everything. I think just for me with my anxiety, it was just a little overwhelming knowing that, the needles are so large and they're pulling so much out. I had 2 wonderful nurses at my side the whole entire time. Like, they really do try to take care of you. They know you're nervous. You can ask for something to calm you down, or ask your regular doctor for like a Xanax or something before you go in. That's what I did, and then I forgot to take my Xanax. I'm sure it would have made things better, but I didn't. Anyway, so got through the biopsy, and then the biopsy takes a minute to heal from. You're a little sore, but I would rather have a mammogram, a biopsy, find out that I'm okay, or find out that I need treatment, than not go get those things done and end up dying of cancer later on, or having a really worse stage or something later on. So definitely, if you're thinking of getting a mammogram, or you're worried about those things, I would urge you to. I really think that all women at age 30 should just go get one preventative kind of baseline mammogram, just to see whether you have breast cancer in your family or not. It's a good idea, in my opinion. I don't know about insurance and what they cover particularly, but that's just my opinion. So going on, they came back and said, yes, you do have cancer in your breast. So let's send you to an oncologist. They sent me to, they first sent me to a surgeon. I will say that they sent me the first surgeon they sent me to. I didn't like them very much. I think she was a wonderful surgeon. I just don't think she was the surgeon for me. And that's really important. When you're in this type of a situation, the person who's making that kind of call to cut on your body needs to be somebody that you feel earned the right to cut on your body, because it's your body. And that doesn't say anything about their personality or their skills or abilities. It's just sometimes that person's not right for you. So the first surgeon, I felt like she wasn't right for me. She just was very to the point and busy and didn't really have time for my questions. And I was scared to death. I had a ton of questions and I didn't ask one of them, and she got shooed out of her office pretty quickly. And so I just thought, oh man, she's not the one for me. and didn't really know where to go from there, but I found another surgeon and went to go see her. She was kind of the complete opposite of the first surgeon. She had a lot of time for me. She did my genetic testing on the spot. She was a really nice lady, but she also wasn't the surgeon for me based on the type of surgeries that she was talking about that she typically performs. And also I had a couple of doctors say that they didn't see as good a results with her surgeries. So I had one last shot at going to see somebody, and I went to see my third opinion surgeon, and she was absolutely amazing. She put my port in. I'll talk about that more in a minute. If you're queasy, sorry. But my port is right here. It comes down. There's a bandage over it right now because I just got back from my first chemo. But there's the port itself, and it runs up here and into my jugular vein. And I'll talk about how that went in a minute. But so she did that, but she's also going to be doing my double mastectomy whenever chemo is done. So it's really important that you find a good team. Don't settle. This is your body. You have to fight for it. You have to stand up for yourself. And if somebody makes you feel uncomfortable, then they're not the one for you, and you can go find someone else. And I even had people say, well, what if there's not time for me? What if this cancer is growing so fast? Like mine grows very quickly, and this is my kitty again. The mind grows very quickly, and what if I don't have time for that? And the truth is, you can start with whoever's available at the time and get your chemo started, and in the middle of treatment, if you find somebody that you are comfortable with, you can always switch. I'm sorry, my kitty is booping the phone. Here, or you want to be part of it? Okay. Anyway, so yes, I loved my oncologist on the spot. So I didn't have to go searching for another one in my case. But if you were uncomfortable with your oncologist, I urge you to find somebody that you feel very comfortable with. And also just double check things, ask all the questions, because in my case, my pathology results were wrong. They came back and my pathologist looked at, or not, my oncologist looked at him, and he's like, this doesn't make any sense. And he actually had the pathologist go take my slides again and reread them and rewrite the pathology report, and ended up finding out that I had a totally different kind of cancer than I was originally told. So that was a big deal, because that changes everything about how we treat it. So you make sure that everybody knows what they're doing. It's totally okay to ask people to check again and recheck, because you need to know what's going on with your body before you get started with treatment. That's super important. So I'm going to go into chemo. So my oncologist has taken the wheel for now. He's going to be the captain of my ship for the moment, because we're doing 5 months of chemo before I can have any surgery. And that's when I'll be kind of ping-ponged back to my surgeon, and she'll do my double mastectomy. So first, for chemo, you have to have a port. So she placed my port, and I don't know if you can just ask. I don't know, different surgeons do it different ways. She did tell me that, but she specifically does it this way, and I really appreciated that. So I don't know if you can ask your surgeon if they will do it this way, but my port has a vertical incision right where a bra strap would be, and it's kind of low down. Any shirt would easily cover it. This up here is just bruising, and it's going to heal. There's a little incision up here because they do have to feed it up into my jugular vein. So I had this done a couple of days ago. Let's see, it's Tuesday, and I had it done last Friday. And all went well. She put me to sleep too. That's another thing. I read online that they just put you in like a twilight phase or whatever, and you're sort of awake. And I told her, I was like, I have so much anxiety about this. And she said, girl, I'm just going to put you to sleep. So if there's the option to ask your surgeon to put you all the way under, then I would take it, because I just didn't even have to worry about that stress at all. Then waking up from the anesthesia, woke up with my port. There's a local numbing, so I was really fine for the rest of the night. The pain didn't really start till the next day. And she had given me tramadol. For me, tramadol didn't work out really great, so I kind of switched over to ibuprofen. But in general, getting a port isn't that big a deal. It creeped me out to have something here. It creeped me out to have something going up into my vein, but other than that, it is just an easy way for them to administer the chemotherapy. Eventually you get used to it, and I had a friend even tell me, give her a name. So mine's Regina. Regina, she's a pain in the neck. But anyway, so today I went in and didn't really know what to expect. I was super nervous. And I have my treatments out here so I just can tell them to you and not get the names wrong because I can't pronounce them. So today I did my first treatment of what's called AC treatment. Okay, so here's like the name of it. And so that one is the more like hardcore one, I guess, the one they give up front to really like kill that cancer. I know they give it for more like stage 3 type cancers and things like that. So if you have a lower stage or something that's less aggressive, they may not start you with this. So they did start me with this today. It was not so bad. I went in and she accessed my port, which was just a little sting, like a tiny little needle going in through the skin. After this initial poke, I didn't feel it. She hooked me up to my pole. And the first thing that she gave me were steroids and Ativan. Just the Ativan totally like chilled me out, calmed me down. The steroids are supposed to help with some of the nausea side effects. And she also did give me a nausea medication. And then there's the 2 types of medication here that she gave me, one after the other. I was there for maybe 2.5 hours in the chair. I brought a pillow and a blanket and downloaded my favorite show on Netflix. And I just sat there and it was no big deal. The nurses are walking around everywhere, so if you needed help with anything, they're right there. But the initial fear that I had going into this just definitely wasn't that bad at all. And I'm super excited to have already started. Now I'm in a place where I feel like I'm actually fighting the cancer instead of getting ready to fight the cancer. I know that there's just a lot of anxiety while you're waiting around. There's so much waiting. There's the waiting after your diagnosis, which is so hard. It's awful. I understand. And then there's the waiting to start chemotherapy. So there's just even more waiting now, but at least I have a plan. I have a team, and I have confidence that my port works. They used it. Everything was fine. I didn't feel any pain or issues or anything. I couldn't feel the medication going up into my neck. She said after it heals, I can sleep normally on that side, or, you know, whatever I do. Right now, I'm not allowed to like lift anything over 10 pounds, but it's healing very nicely. I had minimal swelling, minimal bruising. As you can see, I have some bruising, but I'm really happy with it overall. So yeah, right now what I feel, I'm home. I've been home for maybe 30 minutes, 45 minutes. And I feel tired from the Ativan probably, but I don't feel sick to my stomach. I ate some KFC on the way home. I don't feel, you know, like really run down or awful. I think I'm probably going to lay down and take a little bit of a nap because I'm allowed to, and the Ativan can't kind of wear me out. But yeah, I'm not terribly afraid like I thought I was going to be. Now, I will tell you that the effects of chemo are cumulative, so they do say that you feel worse possibly after each one, or different after each one, or you may have different side effects after each one. So I know my beautiful pink hair is going to fall out at some point. I'm ready for that. So as I make more videos, I'm sure I'm going to make one where I shave my head and you'll get to see all of that. But yeah, and for the most part, I'm ready to do this. And you get that way. You get there. You totally grieve what just happened when you hear, oh my gosh, I have cancer. And the word never gets easier to say, but you get stronger as you go. So I have 4 rounds of the medication that I took today, and that is every other week. And then I have 15 rounds of Taxol after that, so 5 months total in chemo. And then after that, we'll be headed off to surgery and then radiation. Oh, and one more thing. They did give me Neulasta, and that is just I don't have my sleeve rolled up to show you, but it's here on my arm, just in this area. It's like a little sticker almost, but it's like plastic and hard. And my kitty's booping the phone again. She's so cute. Just take a minute for that. Okay. but they show you, they did it there in the office. She stuck it to my arm and like activated it, and it like makes a loud noise and it kind of snaps you, like I think it's a needle poke, and then it starts administering medication slowly over the first 24 hours, and that's just to help keep your white blood cells up. It used to be done where you'd have to come in the office and get like a shot every day after chemo. So this makes it a lot nicer, a lot easier, that it helps keep your white blood cells off so you can still fight infections, or help keep them up so you can fight infections, sorry. And it will be a lot easier to just deal with. Once it's done, I can take it off and throw it in the trash. I don't have to go back to the office with it or anything. So I'll get one of those every time I'm done with a chemo session. So, so I guess that's it for today. And thank you for sharing in my journey. I hope that any of my videos or thoughts or feelings can give you some comfort. When you have a diagnosis like this, it's hard, and you want to go on the internet and you want to find people who are going through it with you, or you want to find people who have done this before. So here I am. I'm going to share my journey as best I can. I don't know what is yet to come, but I'm going to be honest about everything that I'm feeling and everything that I'm going through. I'm not going to sugarcoat anything, so what it is what it will be, but so far, so good. All right. Well, I'm going to sign off here. I'll see you guys later.